Across California are preparing for a crush of COVID-19 patients in the coming weeks. Today I spoke with Dr. Andre Vovan and nurse Syl Trepanier from Providence St. Joseph Health. They tell me they understand the public is nervous and they are sharing a familiar and life-saving message.
I really need for people to stay calm, really. We just need to make sure that we stay in our homes, we care for ourselves, that we would care for ourselves if we had a cold or flu for that matter. There's also all sorts of resources that one can use. I know that the health department has put many out there. We have put some resources out there, like virtual resources, where you can essentially it can help you decipher whether you should be seeking help or not. And we want to make sure that people really practice physical distancing. That is, between physical distancing and making sure that you wash your hands as often as possible. Those are the two things that everyone should be doing. And if everyone do their part, we're going to be in a much better place.
Can we talk about this virus and how it is seeking a host?
So, every single virus needs a host. I'm hoping everybody understands that the virus itself cannot live unless it has a host. And this particular virus comes in through your droplet and infects your lungs. And during the course of the infection, it divides itself. And when it divides itself and infects the other lung tissue, that's where the symptoms and the damage comes into play. Now, most of the time, your immune system within 1 or 2 weeks will be able to suppress it and actually kill it. That's why the young people or the people without existing conditions, after a while, they are cured of that disease because their immune system is able to take care of it. What's worrisome for us is that while they're infected, while they're doing that infection, they don't let the immune system finish before they see the next person out, right? So if they stay at home and they quarantine themselves during their infection, then the virus ends with them. But if they're out and about while they're still having fevers and symptoms, the viruses will hit somebody whose immune system is not as strong.
We heard the county department of public health talking a lot about making sure that you are, basically isolated if you did test positive or you are a presumptive positive, that you're isolated for 7 days and then an additional 3 days fever-free.
That is consistent with the CDC. In fact, the CDC said you have to have 7 days after your fever plus 3 days of being fever-free without taking Tylenol or anything that can suppress your fevers, and on top of that, your symptom needs to be improving to be in the clear to can be considered non-transmittal.
One last question. I know a lot of people are really worried about getting this off of food and such. What is your best take on how this is most frequently being transmitted?
Well, I think it depends on whether or not the virus is on the shell of the food or the skin of the food. And so you may want to wash that before you go. Boiling the food obviously would kill the virus. And so that's the case. I would say that, if the food's already wrapped in saran wrap or something like that, when you uncover it, it's not as likely that someone has touched the inside of the saran wrap. But fruits and fresh foods and stuff like that you're often picking, I would suggest you wash the fruits. And normal soap and water would kill it.
So there you heard it, soap and water for your fruits and vegetables too. And of course, all the glove wearing, hand washing, and extra house cleaning is taking a toll on people's hands, drying them out. I asked Dr. Vovan about using moisturizer after you sanitize, and he says that's fine. It will not interfere with the sanitizer. We want to remind you